My name is Michael Kelly, and I'm an orthopedic spine surgeon here at HSS. So the conditions that I mostly treat are degenerative conditions in the spine, whether they're in the neck, the mid-back, or the low back. Majority are related to arthritis and degenerative conditions. Typically, sometimes those manifest as stenosis or compression of the nerves, compression of the spinal cord, radiating neurological pain. My goal as a physician, particularly as a spine surgeon here at HSS, is to simply take the best care of the patients that I can. And I think that starts with defining what the patient's problem is, defining what their chief concern is, and then ultimately offering them the best treatment option that I can for them. Spine surgery, in many ways, is scary to a lot of patients, and rightfully so. Spine surgery should not be treated lightly and taken lightly, in my opinion. It's something that I treat truly, even as a surgeon, as a last resort option. I always tell patients that there are pros and cons of every treatment that we do, whether it's physical therapy, stretching and strengthening, or a big spine surgery like a spinal fusion. And for that reason, I always try my best to educate my patients and the family and the supportive friends, whoever it may be, on the risks associated with spine surgery, the benefits associated with spine surgery, and always the alternatives that the patient has for treatment so that they're educated on the situation. Whether it's doing non-operative treatment with physical therapy, injections, medications, or considering more aggressive treatment, something like a multi-level spinal fusion, it's really important to get it done the right way the first time. And that's because in the spine, sometimes there are multiple different levels, multiple different areas or sources of problems, and you want to ensure that you don't do too much treatment or not enough treatment. It needs to be the perfect amount for the right person at the right time. So endoscopic spine surgery is a technique that's been around for a very long time, and it has more recently gained more popularity in the United States. It's a procedure that's been around very popular in Europe and Asia now for many decades as a minimally invasive alternative to spine surgery, where, very similar to surgery in the sports medicine field, we use a camera to introduce our instruments into the spine to get our eyes all the way down into the spine so we can see everything in great high definition and make minimally invasive incisions. To have a patient with a successful outcome is an incredibly good feeling, and I think a feeling that most spine surgeons strive to have, and probably one of the feelings that a lot of us go into spine surgery for.